We're back with Dr. Allison Marsh with Cone Health Community Pharmacy, talking about cleaning out that medicine cabinet and then what kind of essentials you should be keeping. Okay, so let's get to that part. We've cleaned everything out. What are the essentials that we should all consider keeping in our cabinet?
Absolutely make sure that you have a working thermometer. You'll always need that. Medication for pain and fever, so Tylenol, ibuprofen, making sure you have allergy medications on hand, and especially if you have people that do have allergies to medications or food, have an up-to-date, not expired EpiPen. And some of those as needed albuterol inhalers are good things to also keep on hand.
Okay, now if we have like kids, tweens, that kind of stuff, what additional items should we have in that medicine cabinet?
That's a good question. So definitely for little kids, they have specifically with like our fever or pain medications like Tylenol, ibuprofen, they have child specific doses and they come in liquid because so many kids can't swallow tablets or capsules. So that's important to keep on hand. I also recommend making sure all medications are stored high, maybe using, some of those safety clasps on your cabinets. Really, all medications that you get, whether over the counter or prescriptions, should have safety caps on them, and just be sure to keep them in those safety cap bottles to help prevent our kids from getting into them. So.
All right, now you mentioned if we got kids to put those up high. Here's now what I want to ask, because you've always had a medicine cabinet in your bathroom, but is inside your bathroom where you should be storing your medicines?
No, you often think of the house that has, when you walk into the bathroom, that little cabinet behind the mirror. Well, that's not the ideal place to store it. We want to store medications just generally anywhere outside of a place where it's going to be humid. So the bathroom is not ideal. That can be bedroom, kitchen, whatever it might be, but not the bathroom.
Right, because you're taking showers, you're steaming things up and all that other kind of stuff, and it can actually change the medication.
It can. It absolutely can. So.
Okay, so now that the cabinet's cleaned out, it's stocked, it's organized, how often should we be doing this?
Really, I would say I go by twice a year. So if you time it up with daylight savings, you can just do it that way. You're already making changes around the household, resetting your clocks. Go ahead and clean out your medicine cabinet.
Okay, and is it something, do I have to be like totally organized, like have everything like written like what we have, or a list of just what I take on a regular basis?
You don't have to be totally organized necessarily. One thing that I recommend is you can get little stickers, and if you have medications that are going to be expiring within the next 6 months, you can put a little sticker on it and say this expires in December or whatever it might be. That way, at least in the interim period between cleaning them out, oh, my Tylenol is going to expire. I don't want to take this after this time period. So.
Gotcha. Okay. And then how important is it to share your medication with like your provider? And that includes your pharmacist. I think sometimes we kind of don't think about that.
That's very important, especially if you have multiple providers or maybe you get medications from multiple pharmacies. It's really important that every single healthcare professional that's involved in your care knows each and every medication that you're on. And because so many medications interact with each other, can interact with different foods, disease states, whatever it might be, I recommend for patients to have a little typed up list that they keep maybe in their wallet of the medications they're currently on, and making sure that they provide that to every healthcare professional that they interact with.
Great. All right. Thank you so much for your time and your expertise. And now we're all challenged to go clean out that medicine cabinet. If you missed any of this, this is going to be in the To Your Well-Being section of our website.